afternoon, everyone, and welcome to the Texas Developmental Screening and Surveillance Echo brought to you by UT Health San Antonio in collaboration with the Texas Department of State Health Services. My name is Maria Gutierrez, and I will be facilitating today's session. Before we do get started, I want to go over a few housekeeping items. As Karen has posted in the chat to help us with attendance, please enter your full name, affiliation, and email. This does also help us out with keeping track of your TechPed certification. As a reminder, all sessions are being recorded for later distribution. Please do remember to stay muted unless you are speaking, though we do encourage using the chat and or raising your hand feature to pose any questions, share perspectives, and just be lively throughout today's conversation. If at any point you are having any connection issues, please privately chat Karen, our Echo IT assistant for today. As always, to ensure privacy, no personal health information is allowed at any point during today's session. This does include names, addresses, birthdays, or any other identifiable information. Let us make an effort to always avoid biases and stigmatizing terms so that we can continue to have a safe space that is respectful and encouraging for everyone to learn. Lastly, today's session will begin with some introductions from the team. We'll have a didactic presentation and then a case study where we'll all just stay in the main session today. So with that, we'll move over with some team introductions. Dr. Mendel.
Hi, everyone. I'm Dorothy Mendel. I'm an associate professor at UT Health Houston School of Public Health, and it's great seeing you all today.
Thank you, Dr. Mendel. Faith?
Hello, everyone. My name is Faith Rivera, and I'm the CEO and Principal Consultant with Alice Avitas Consulting. Thanks so much for joining us, and a happy.
Thank you, Faith. We also have Dr. Jennifer Cox.
Hi, everybody. I'm glad that you are here with us today. I am Jennifer Cox. I'm Senior Director for Provider Support and Training with My Health, My Resources in Tarrant County and work directly with Help Me Grow North Texas.
Thank you, Dr. Cox. And our guest speaker today, Sarai Calderon.
Hello, everyone. My name is Sarai Calderon, and I am an infant and early childhood mental health consultant at Any Baby Can of Austin.
Thank you so much, Sarai, and thank you everyone else that's continuing to introduce themselves in the chat. With that, I'll go ahead and hand it back over to you, Sarai, to begin your presentation.
Thank you, Maria. All right, everyone, I am going to share my screen with my presentation. Thank you all for being here, providers, teachers, for taking the time out of your wonderful Friday to spend some time with us. Okay, can someone give me a thumbs up that you can see? Okay, awesome. So again, hello, my name is Sarai Calderon. I am a licensed social worker and I am an infant and early childhood mental health consultant at Any Baby Can of Austin. Today, I am going to be presenting this wonderful presentation that I came up with for all of you, which is titled Leading Difficult Conversations, a Reformative Approach. Did the screen change? Yes, okay, perfect. Okay, so let's talk about the importance of positive communication. As teachers, providers, directors, we always hear it's important to cultivate and to have positive communication with parents in teaching spaces, daycares, Montessori's, etc. And so what's the importance of this? Well, whenever you establish positive communication, it's easier for parents and providers to collaborate towards common goals. There may be difficulties in the classroom that parents may not be seeing in the home. So whenever you establish that positive communication, it can become seamless to have those difficult conversations where you exchange what your experience is and what your observations are in the home versus in the classroom. It also improves overall student performance whenever you establish that positive communication and you can send text messages or have phone calls with parents. Attendance, behavior, and academic concerns can all be addressed in a way that is not an attack for parents. And it also just helps build trust and relationships. You are providing care, you are teaching children, and children are a parent's most loved little person. So it's important to have and to have trust with the person who is caring for them 7, 8 hours of the day. It also opens channels for immediate intervention support. So if you do notice that there is a child that needs intervention and you have that direct communication and it's a positive communication with the parent, whenever you suggest that they may need additional support, it can maybe become easier for the parents to be receptive of it. There's also the benefit of consistent home and school connection. Whenever you are talking about, this is what my child is like at home, this is what my child is like at school, you can connect with the parent to kind of go towards common goals. Also, just providing regular updates about what a child is experiencing in the childcare setting or in the school setting. And the most important thing that I'm sure all of you have heard before is that starting early builds trust for future conversations. Whenever you are going to have a hard conversation, starting early from the beginning, from the first meeting with the parent, is how it will help you to lead those difficult conversations. So whenever you first meet the parents, a helpful tip is to always establish rapport and maintain positive communications. For example, let's say it's the beginning of the school year, you are meeting parents for the first time, introduce yourself, tell them your names, shake their hands, share a form of communication. If there's an app that your school utilizes, provide that clear, direct line of communication for them and send updates, consistent updates, not just updates whenever there's a challenge or when there is a behavior that needs to be addressed. So if you want to give praise to a child, for example, Timmy helped a friend pick the correct color today, and you want to send that praise, that establishes that early positive communication. That way, later, whenever there is a challenging conversation that has to happen, you already have that established positive rapport. And so to understand why you have to approach a family and a person and have those positive communications, it's important to consider the ecological systems theory. I hope that you all have heard about this before, but basically it's a person and environment theory. So it's an approach that evaluates every single part of a person's environment to understand behaviors and shift what can be considered a problem to a result of system interactions. So in this beautiful image, you can see that there is an individual in the center, and then there's a microsystem, which includes family, peers, and then there's an exosystem, which is the greater part, like local policies, media, local amenities. There's also the macro system, which is the culture, economic structure, laws. I did miss the mesosystem, but the mesosystem involves creating the relationships and the people who you surround yourself with outside of your peers and family. And so looking at an individual, in this case, whether it be the child or the parent, as part of a larger system, can help you understand the greater picture. It can help you understand that maybe a parent isn't as receptive to the approach because they have situations at work that are going on and they may be struggling financially. So maybe their child having behaviors in school is not going to be their biggest priority whenever they are in fight or flight mode, they are in survival mode. As well with the children, if a child comes from a home where there are several problems, several things that they are dealing with, such as inconsistency within the family, maybe financial instability, then it can also affect the way that they show up in school and the way that they interact with others. So understanding person and environment when having conversations with parents allows you to get context regarding home life that may directly affect their behavior. Again, instability in the household sometimes can show up as negative behaviors in the classroom. It also encourages collaboration and partnership. So whenever you are looking at a person as a part of a whole system, you can utilize open-ended questions to really deepen your understanding of their current situation, whether it be a child who is having a hard time and hitting other people, a child who is biting, a child who is refusing to do things in the classroom or follow directions. Using those open-ended questions when collaborating with the parents can help you really understand what it is that this child needs to be successful. It also creates a space for empathy and vulnerability. And within teacher, parent, or provider and caregiver relationships, vulnerability is where the deepest connections are built. because whenever they open the door to let you see what is going on in the background, things that you cannot see just from pickups and drop-offs, that's when you can really empathize with the family and understand, hey, they're probably going through something deeper than just, I don't want to talk about my child's challenging behavior. And that also provides a space to connect before attempting to correct behaviors. So connection over correction, that's the best policy whenever you are working with children, because if you do not connect with a child or with their families before trying to correct their behaviors or correct a parent's approach to difficult conversations, then there's not going to be any positive interaction there, you know? You need to connect with them before really trying to tell them that something isn't working or something isn't going correctly in the classroom. So this is where the reformative approach comes in. Reframing when having these conversations is so important, and it helps transform negative communications into conversations with positive outcomes for the children. In the end, it's always about the children and about them being successful in the home as well as in school or the child care setting. So some tips for reframing these conversations include initiating by acknowledging that some conversations can be difficult. You can literally just tell the parent, hey, I know that some conversations can be difficult for you. If you have any questions, please feel free to ask me or interrupt me at any time. Also reinforcing that partnership and saying it's important for us to have this conversation as we are working towards a common goal. A lot of parents can easily feel attacked whenever they are having these difficult conversations with a parent, especially whenever it comes to diagnosis and there's language that is being utilized that they don't really understand. Parents can kind of freeze and be like, whoa, hold on, like what's going on? I don't understand this and I feel attacked. So making this statement of we are partnering, we are working together, the common goal is the success of your child, that can definitely help reframe that attack that they feel. And utilizing clear language, leaving no space for misinterpretation is also very important. Here in Texas, there's a lot of diversity. So there's a lot of people who maybe English is not their first language, and there can be that not only language barrier, but communication barrier as well. If you are using these very professional words that some parents may not understand, then there can be room for misinterpretation if they do not know exactly what you are saying. So utilizing clear language, being very specific and straight to the point while also holding space for empathy will help guide these conversations. And then approaching the conversation with the intent to listen actively. So we hear this in all parts of our lives, listen to understand, not to respond. Whenever there is something challenging happening in the classroom, it can make your job difficult. It can cause stress. It can cause barriers for learning with the other children. And so it can be very easy to just respond with what you think would be best to lead the conversation, but really taking that time to listen to the parent and to understand where they're coming from and how you can collaborate before responding just out of instinct can help not only continue to build that rapport, but really cultivate in the relationship. And reframe the words used. So this is what I was talking about earlier when I said using clear language. Saying things such as retain can very easily be reframed into remember to help a parent understand better. Or for example, proximity can be reframed into near, or do not can be framed into don't. And even small changes in the verbiage can really help a parent understand where you're coming from better. And I came up with this beautiful analogy, which is laugh, don't cry. And so laugh stands for L is listen, empathize, and communicate respect. A is ask questions and ask permission to take notes. F is focus on partnering to resolve the issue. F is find a first step. So this is what is recommended. This is something that you can take a picture of or a screenshot of to help you guide these conversations. These are do's and don'ts to help parents connect and be involved in the conversation, again, without feeling attacked. Having difficult conversations about a child who is under your care can be very difficult for both yourself and the parent. So utilizing this analogy can help you get into the reformative mindset. Don't cry. CRY stands for see, criticize parents, additional teachers, or children. It's very important to not criticize anyone whenever you are having these difficult conversations, because a lot of times parents will say things like, well, my Jimmy only does that because little Charlie reacts. And so if you criticize the child and say, you know what, Charlie does react, but Jimmy also reacts, that's already a criticism, and it really breaks that rapport building. R stands for react hastily and promise something that you cannot deliver. A lot of the times, there's a lot of hope that is raised when having these conversations, but it's really important for you as a professional and provider to not promise something that you cannot deliver, especially whenever it comes to providing individualized support for children when you know that it's not feasible considering all your responsibilities that you have to do at work. And then Y stands for yakety yak yak, so unnecessary talk. There's no need to do beating around the bush and to have unnecessary talk whenever you are trying to have a difficult conversation. It's important to get straight to the point while holding space for empathy. These are my references. Thank you all for watching. I am open to answer any questions. If you want to drop anything in the chat.
Thank you so much, Sarai, for that. I think the last part was like so beautiful, limiting the yakety yak yak. So I think that's something I'll start using on my own. But kind of just going back to your presentation, I think health literacy is just so important. And I'm glad that you brought that up because, you know, matching that literacy and communication conversation that you have with parents truly, you know, sets a tone for the rest of the communication that you will have with them throughout the school year. Any questions for Sarai or comments? Please feel free to unmute or use the chat.
Let me see. Good morning. Say good morning. Good afternoon. I have a question.
Sure.
Could you possibly put the little laugh cry back up there? I was trying to find my phone.
Absolutely. One sec.
Also on the laugh part, I was thinking like for the F, I would also use like a funny or fumble, just kind of share one of my experiences of when I fumbled as a parent. So it kind of puts parents at ease, like you're not above them, like you understand some of the issues that come up and possibly didn't do well the first time, but you know, you've since learned from it. It just kind of puts them at ease that I found. And so I'm going to put that out to the side, but thank you for putting that back up on the screen.
No, absolutely. And I think that that's a wonderful point that you just made. Building that relationship, whether it be saying like, hey, I'm a parent too, I've struggled with something similar to this, can also really help lead these difficult conversations. Of course, without making it primarily about yourself or your experience. Always keep in mind the why you're sharing with the parent what you are sharing. Anyone else have any additional questions, comments? Or just strategies that you utilize when handling difficult conversations that you'd like to share with everybody here?
A comment I do see in the chat from Sandra. She now uses the following terms. It matters to Jimmy what he needs from us. We need to know more about Jimmy so that we can help him. Definitely see some positive comments in the chat. And just a reminder to all participants, PowerPoint presentation slides will be shared after today's session. And there is another question. Can this course be offered in the evening as an instructor lead? So I think maybe this is just kind of going back to like, is this a specific training that can be offered for teachers, or how can, teachers just learn more about the strategies and the acronyms that you just presented, Sarai?
Yeah, that can definitely be something to talk about with Any Baby Can team, and we can be in contact to see if we can offer something like that in the evening.
Okay, I think with that, we'll go ahead and move on over to our case scenario. Aaron, when you get a chance, or I'm sorry, Sarai, will you be sharing the case as well? Would you like IT to do that for you?
I can share it.
Okay.
So we would like some interaction from everyone here on the call. This is a case scenario about Martin, a 5-year-old who has been struggling to build peer relationships. He has been seen pushing classmates during playtime. And when you discuss this behavior with his parents, they state, well, that can't be right. He gets along with all the neighborhood children. Based on the reformative approach that I discussed, how would you approach this? The parent's statement is that they have observed their child interact with familiar children, and there is denial about the concern brought up by the provider or teacher. Would anyone like to share how you can approach this hard conversation with the parent?
I'm wondering if we can change the view so that we can see everybody, because it's hard to see if somebody is coming off mute or somebody has their hands raised.
I have a comment. So perhaps you can invite the parent to observe for a moment and to see what you are observing, and to ask them, do you know, or ask them, how do they handle this behavior at home?
I think that's a wonderful point, trying to understand how parents handle the behavior. I think in this case scenario, the parents are stating that they do not see that behavior at home. So if they haven't witnessed that behavior, how would you approach it? If there's that wall of like that's not what happens at home, how can you help them reframe that to collaborate?
Hi. If I'm understanding what she said correctly, it's like I have permission to videotape my kiddos. And so if I see that behavior and if I could get a little snippet of it and, then explain the situation, what was happening before and after, and that way they can visually see it. Because sometimes they're in denial and sometimes maybe it doesn't happen based on the other kid's age or whatever the scenario is. And that way it shows that there is an issue and that it does need to it needs to be understood and on both sides. Like maybe there's something that the parent doesn't understand. Maybe there's something the teacher doesn't know that just needs a little bit more insight. Maybe there's a trigger. I mean, I just think it's worth having them see the visual, and it kind of pulls them away from the idea of, yeah, this doesn't happen.
I was thinking along that line as well, because it's not happening at home. He get along with peers, different cultures, different, their play dynamic. So what we may view as something, a parent may not look, it may be going on, but that's not it. I think a little bit need to see what triggers, what is going on, what type of play is happening, the whole scenario for you approach the parent, so you have a lot more information, and just talking to the parent and see what type of activities, and children, are they younger children, are they older children, per se. So you have to take that in account.
Absolutely, Sharon. Thank you for sharing. Tim, I saw you had your hand up. Did you have something to share?
They both covered it.
Okay. Awesome. Yes, these are all incredible ways to approach the situation. Does anyone else have maybe an alternative approach? What if you can't videotape a child? Because not all the centers allow that. So how would you approach it then?
I do see a comment from Marisela. Are you able to unmute and elaborate? Because I think that's a perfect answer to Sarai's question. Okay, no worries. Microphone doesn't work. But Marisela Cruz did mention that you can invite the parent into the room to see how their child interacts with others. How feasible is that?
I think it really depends on the additional needs of the classroom, because if bringing a parent in can dysregulate the dynamics in the classroom, then how would that be maybe counter-effective of bringing them in? I can see both scenarios where it may be effective, and then in other times it can just be, counter-effective bringing them in, maybe cause some chaos, some disruption, also depending on the age of the children in the classroom. But that is a great point.
I want to bring in another point. Amy kind of is alluding to this too in her response, that she's had that situation. And I acknowledge that this can be confusing because the environments are just different, as well as the ages of the other children. And I was wondering if anybody could talk about, like, it's okay that mom says that she doesn't see this, but it doesn't make it not happening in your environment. So how can you reframe this to actually start the conversation instead of closing down the conversation? Go ahead, Tim.
So one of the things I always do is acknowledge that what the parent is saying is true for them. And so, starting there and not trying to push back against, well, you should see this at home with that kind of attitude. But then I also start to break down all of the elements of the differences between the home environment, the outside play environment in the neighborhood versus the 8 hours of interactions in the singular classroom, and how those dynamics can be different. So I think taking the time to walk them through those different steps can create a different picture about the situation. So it's not necessarily that the pushing and everything is an intentional going after to harm somebody, but it's a reaction to the communication not being there, and especially if they're an only child and they don't have that sibling relationship at home to deal with, how those dynamics can be different in terms of what they learn from the parent versus what they learn from other kids their own age. So, but I always acknowledge that they're probably right, that it's not going to be seen at home if these other structural rules are not in place that we have for the classrooms.
I mean, how many of us line our kids up at home before we leave the house? Sandra is saying something very similar to what Tim said, as taking into account that the child is communicating something, and what is the child communicating?
Yeah, I definitely think that taking into account what the child is saying can help also guide these conversations. The hope is that parent and provider can collaborate and take into account what the child is saying to really come up with a plan. How do we support this kiddo? How do we go from here to help them both in the school environment and to maybe bring in some of the behavior that exists whenever they are interacting with familiar children?
I would like to say something. So, hi, I'm Jimenez Hassan from Any Baby Can Too, and I work with Sarai. And one of the things that I hear here is that we're trying to prove to the parent that this is happening. Like we come in already into the conversation with, well, your son is doing this and that's wrong, and he shouldn't be doing this, and I need you to correct that child so that doesn't happen. And if you start the conversation like that, that's like a downer, because right away the parent is going to go into defensive mode and say, well, my child is really well behaved, so why are you accusing me? Maybe it's another child. And it really closes the conversation. That's like we're trying to do a reformative, like Sarai said, reformative, what do you call your presentation approach? Yeah, reformative approach to having difficult conversations. And usually we could start by saying, how could you, like, this is something that's happening at school. Like I see this happening. Thank you for sharing that. This is not happening at home. And I'm really glad this is not happening at home. And could we work together to see how can we help Jimmy succeed in the classroom with his classmates? Maybe do you have some ideas that have worked for you as a parent that we can incorporate, so that way we empower the parent and say, hey, our parent is being empowered. The parent is doing a great job. Thank you for raising this child. Could you give me strategies that could work in my classroom? So suddenly you empower the parent to be on your side, instead of us trying to videotape or say or have the log and say, here, you see, he's not behaving in my classroom. What's wrong? And usually, like what we do as parents is we throw the ball back to the teacher and say, well, it's your job to control my child, and that's why I'm paying taxes, or that's why I'm paying, so that back and forth really closes the bridge to communicate. And I would love to hear from teachers. I'm not a teacher. I'm a consultant, but I've been in that situation where people say, you're not doing a great job. And I me as a parent say, yes, I'm doing my best. And I don't know, maybe you're not doing it. And if conversations start that way, that's okay. So I invite everyone to think about, like Sarah is saying, how do we turn around the conversation where the parent is on our side and is maybe going to help us as a professional, as a teacher, to, okay, maybe, and always think, what's the need behind the behavior? I think that's a huge way of approaching bad behavior or any type of behavior that is disrupting in the classroom. We want to go behind that behavior and say, okay, what is he trying to say? Like somebody mentioned on the chat, and how can we help that child and that family and that classroom to be better in every way.
Tim, you want to chime in?
Yeah, so when she was talking, it reminded me of a parent, and this happened fairly recently. We had a 4-year-old start with us, and he had been kicked out of 3 different centers prior to coming to us. So we kind of expected that there was possibly going to be some disruptions. And so after about 2 weeks, started having all the things that we're talking about here happening with it. So when I called the mom in, I said, I just want to know some more background about your son, and divorce situation. Mom works double shifts. Child has to go to the grandparent at 5:30 in the morning, and then the grandmother brings him to us at 7:30. So just lots of disruptions for this poor little guy. And I said, well, I'd really like to sit down and meet with you and your husband both, because he's in these multiple environments. He's, with you sometimes, he's with dad sometimes he's with grandma, and then the rest of the time he's with us. And she was like, oh, no, that's not going to happen. His dad won't do that. And I said, well, we're running out of options, and I need every adult that's in his life to be a part of this conversation. So she storms out of my office, and I'm like, okay, if that's going to be the reaction. And about an hour and a half later, she called me on the phone, and she was just in tears. And she was like, I'm so sorry. I shouldn't have done that. I was just so overwhelmed by the situation. And I said, I understand that. I get that. And I appreciate you calling me back, but we still need to have this meeting. So, and she convinced the divorced husband to come in and stuff. And so we were able to drill down through the dynamics. We knew where the behavior was coming from. But we put the challenge back on them that in all four of these environments, the rules had to be the same. And without that, he was not going to progress. And so he's done extremely much better. We still have our days and stuff, but it's not every day and it's not all day like it was before. But again, acknowledging that that mom was doing the best she could, working double shifts, not really being able to have any time with him at home when she gets home, and just the disruption to his sleep patterns and all the other things that it was like, okay, this child gets here in the morning, he's tired. We're going to let him take a nap before the day starts. And so that was one of the things we put into it. But we encouraged grandma to do the same thing. Once he got there, let him fall back asleep before you bring him, because again, that sleep disruption is going to cause him to have issues later in the day. So, um, but I've never had an experience where a parent has left angry and then called later and apologized for that. So that was kind of cool.
I do see a comment from Cheryl. We explained to our parents as part of our enrollment process that we are here to teach your child, not parent them. This is a partnership between you, the parents, our staff, teachers, and management, and the child. And I think that kind of just reinforces the conversation that we're currently having is, is that we also want to let the parents know that they could also be a teacher, to also let the teachers kind of know from them in their specific environments. Comment from
I
Sandra,
have a,
even adults get cranky if they don't sleep well. Yes, very true. Go ahead, Deirdre.
okay, I have a comment. Diltra. Okay, but environment. I heard someone say environment. You know, and boy girl behavior is sometimes different. The way boys express themselves is different than with girls, and if there is any type of attachments that the child has going on, so you have a boy that's attached to the parent or whoever is bringing them, and then he might have a shirt on that's too hot or something. So you want to look at, so if they're not behaving the same way at home, perhaps the temperature is different too. So we um, remove, if they have a change of clothes in the facility where they attend, ask them, are you hot? Is that outfit, is that sweater or something, is too warm? And if they tell you, then you change it. And sometimes I've had to even put a piece of ice in a child's hand to help calm them down, and it was instant. So you have to look around in their environment to see how we're going to be able to help the children regulate. Because the comment before, the question before reminded me of something that I've learned. You have to regulate before you can instruct. You have to help the child regulate. They don't know how to do that. So that's what I have to say.
I was just thinking about what you just said when it comes to this particular case study too, about those points of dysregulation and maybe opening with that with the parents of he seems to get dysregulated when he goes in and he's shoving kids, and we want to talk about things that you've been doing to help him re-regulate. And it's okay to point out a behavior without proving the behavior. Because I just want to say that. So Harry, do you want to add a little bit to that, of maybe coming into that point too? I thank you so much for bringing up regulation, because I know we've been talking about it in the last 2 months, so I appreciate it coming back around to that.
Absolutely. Acknowledging regulation or dysregulation both in the classroom and in the home, and understanding what routines help my child maybe transition better, or what transitions make my child feel dysregulated. Can, especially in this case scenario, because if the transition into playtime with the neighborhood children that the child already knows doesn't cause a dysregulation, then why is it causing a dysregulation in the classroom? And so having that conversation and acknowledging, okay, what does it look like for this child before they go out and they play at home versus what does the school transition look like whenever they are in the classroom setting? It's a wonderful, wonderful point.
Cheryl, I've seen you've added another comment to the chat. Are you able to unmute and speak on that? Well, it looks like Cheryl and her team spent a good portion of their days positively redirecting children's negative behaviors, helping them calm down through walking with them, breathing, drinking cold water, so that they're better able to articulate the root cause of the behavior. Tim also makes a comment, you may be able to use different words to explain deregulation. That is not a term that non-teachers use, so that it can be confusing to a parent.
Tim, can I ask you then, how would you talk about that?
So for us, it's more framing, how they control their emotions and their responses to situations. And like I said, I know we're talking about regulation, deregulation, but for the parent coming in with that and then maybe adding that word in a little bit later in the conversation. Because if what I have found is we that are in academic backgrounds tend to talk in what we were trained in. And the common observer, if there's a word that they don't understand, they may not feel comfortable even asking you what that word means. And so they're already kind of lost in the conversation. And also not making it sound like we're putting ourselves above them in that sense. And I think somebody mentioned that earlier in the presentation. So just being cognizant of that, or if I'm not seeing that they're responding to the words that I'm using, trying to figure out, okay, how do I put this in a different context that is more digestible for them?
There's an analogy that some providers utilize where they grab like a clear cup and they put marbles in it. And they're like, okay, these are how many marbles you start your day with. And after little things happen, after a child is screaming too loud, or after my breakfast didn't taste the way that I wanted, you lose marbles from my cup. And it shows the emotional capacity that children may have in the moment based on what they already experienced during the day. So if that's a tool that is something that you can utilize with parents as a teacher, a visual to help them understand, okay, what does dysregulation mean? What is their emotion, the extent of their emotions at this moment? Because sometimes explaining it as your child is having big feelings also won't be something that they can understand just as dysregulation, because to parents it can be like, well, yeah, of course, we all have feelings. What are you talking about? So visuals can also be a good tool to keep in your toolbox, your professional toolbox.
Any other thoughts or comments from our hub team on today's case? Or any other feedback suggestions for learners today?
Cheryl's team's offering a lot of great. I'm sorry your camera and your microphone aren't working, but I appreciate all the chatting. Cheryl's team also said a welcome activity that I see used in my classrooms is during morning circle, welcoming each child and asking them how they are feeling today, which I know is a major point of reformative practice, and it's nice to see that being brought in.
Hi, could I add just one thing?
Mhm.
I just first want to say thank you guys for all the great ideas. That gives me some more tools in my toolbox. But what I wanted to add is when I was taking an ABA class, like the behavior, sometimes a child doesn't want to do something, so they act out, so they don't have to do that particular thing. So one thing I try to do is see if this behavior happens before a certain thing starts, like before outdoor play, if they don't like being outside, or before let's say it's time to eat because they're really finicky eater, or if it's happening before, whether they feel like, well, if I do this, I'm going to be able to get out of this other thing. Just kind of see when when they're triggered, like, is it always at the same time every day? Or if it's always near this person, can we separate these two children? Just kind of observe really closely to see if it is something that, of course, is happening only at school, because this only happens at school versus it happening at home. And then try to have sometimes a positive reward helps with certain situations once you pin down if it's based on something that they don't care to do or something that they just don't like.
I just want to support that, Carolyn, because I'm just thinking my daughter has started throwing fits before reading time. Try to get out of reading. All the different ways we're trying to avoid that or sneak it up on her.
I am back. What a time for a fire drill.
Welcome back, Jennifer.
Any other comments or questions from the Learning Network today? Everyone that's joining us.
I have one more comment. I can't see how to raise my hand on this device right here. But I use a lot of visuals, and I talk frequently with the parents. And what I do, I share with them, and they do understand. So because it is visually demonstrated, like breathing is very important to helping a child calm down, and I tell them the importance, and I show them. So, and when I ask the child out, sometime I use various techniques, but I have them to breathe on my hand, breathe in, and to blow on my hand. And then I'll let them blow on their own hand. And in that process, they are coming down. They are coming down. If we're outside, something that can be done. I mean, first of all, outside is just really good because they're able to let out a lot of the frustrations on just running. But they can blow bubbles outside because that's also helping them to calm down, helping their mind to calm down. So there's a lot of visuals and that you can give to a lot of practical ways that you can share with the family, and it's not complicated. They can understand that. Okay, that's all I have to say. Thank you.
Thank you for sharing that.
Dr. Mendel, would you like to give us a summary of today's session?
Sure. Thank you so much for everybody for joining and for engaging in this great conversation. I really appreciate everybody who contributed in the chat and in coming off mute and making comments. This was a great discussion. I think one of the things I'd like to do is bring this back around to what we've been talking about over the past few months about establishing and having these hard conversations. Starts with having frequent positive conversations first. And where that base boundary, that base is so important to build. You guys heard that from me, from what parents have been telling me for the past few years as well, is those hard conversations are easier when a positive conversation and positive communication has already been established between you and the center. So thank you for bringing that back around. The connections, making the connection first before you start the hard conversation. Um, I really liked that starting with open-ended questions instead of telling somebody, asking somebody, and starting with those open-ended questions that allows parents to tell you what's going on and to be vulnerable with you. It really opens up. I know in childcare, you guys have been learning about this as well as in other practice situations and other education settings. We've been talking about using a trauma-informed lens, and that's very much aligned with what we were talking about today as well, is that if you open up the conversation, you can see there's a lot of things going on in the lives of these kids and of these parents. And that may open up a new avenue for you as a teacher to help handle these more difficult conversations and difficult behaviors. Um, Using clear language and leading with empathy. I really like the no yakety yak. I'm not a big fan of yakety yak, and I think I'm going to use that everywhere now. Is getting to the point. We think that talking around a problem softens the problem, but it actually can make it much worse. And getting to the point and using clear language and leading with empathy. Um, I also loved the point that we need to listen to parents honestly and openly first. Is that honest and open listening leads to a better response. And, parents do come. I've told many of you the same thing. I've had these hard conversations with my daughter, and I often am the person going, I don't see that at home. But you're not asking me to say, I'm not denying that it's not happening with you, and recognize that when a parent tells you it doesn't happen at home, they're not denying that it's happening with you. It's just they don't see it either. They don't see that conversation. And that changes the direction where you can say, well, maybe there's other ways that we can address this. Not you see it at home, I see it here, you need to do something about it. So listening to the parent honestly and openly before responding is a great first step. And I really appreciate that point quite a bit. I really liked how everybody in the chat after this case study, we talked about how they have the conversation and open the conversation with the parent, but also so many of the suggestions in the chat and so many of the suggestions also are, well, what as a center can I do to handle this behavior more effectively on my own? Because it is happening in your environment and there is something that you can do about it. So getting into that point too of looking at those triggers, digging deeper on your side as well. And if it does require working with the parent, I believe Tim talked about it very clearly about what are consistent rules that we can have in these environments that helps the child either in the child care center or at home not engage in these behaviors, because maybe the parent has a very specific rule about how they interact with the neighborhood kids that makes that interaction go better. And so that's kind of like my summary of everything that happened today. And yes, Cheryl, exactly. It's hard for a child to step into a group care situation where they are one of many versus a small number of siblings, if any, or a small number of neighborhood kids as well, and having to learn to practice patience, wait their turn, share toys, etc. And that absolutely is incredibly 100% true. There's very few environments that kids come in that mimic a child care center environment. And recognizing that as yourself as a provider, is that you are a unique environment for these kids and an important environment for these kids and an important learning environment for these kids, but probably unique. And so you may come up with your own, you may see your own unique behaviors that you're going to things these kids will never do at home, and recognizing that. So that's kind of my summary, Maria.
Thank you so much, Dr. Mandel, for that great summary. And thank you so much, Sarai, as well, for presenting today's didactic and case. With that, we'll go ahead and start wrapping up today's session. We do welcome everyone to join us at our next session, Friday, June 12th. And as always, we'll go ahead and share the TechPeds QR code and link in the chat and on the screen for y'all. Please do remember to complete the TechPeds evaluation to claim your credit. And also, please remember that an account is required to claim credits. With that, we'll go ahead and say thank you, and everyone, have a good weekend.